I just keep thinking in terms of access to healthcare, and this is particularly problematic for trans people in the St. Louis region. Um, there are a lot of basic services that people are lacking. Access to hormones for people who want to medically transition. Let me be clear. People who are transgender do not all want to medically transition. But for some who do, it is a dire need to have access to hormones. And there are people buying hormones on the street right now. Sometimes people are searching and searching for an endocrinologist who will treat them and just having difficulty getting an appointment. Um, we don't have a healthcare system in St. Louis that is supportive of adult transgender people. We've got a great system for people 24 and younger through the spot and through the clinic that was set up at Children's Hospital. But despite the fact that we have two huge university hospitals in St. Louis, getting help with medical transition or just basic health care when you're trans is a major impediment right now.
Hayden, can I say a word about the spot? Because your audience might not know what that is, but it's a pretty effort, really focused in on adolescents, young adults, and meeting their comprehensive human needs. So in addition to their healthcare needs, in addition to LGBTQ youth, then thank you, Amy, in the chat that sent you to the website. But one of the things I have people, leadership from the spot, come and teach in my classes every year. And the leadership had to make really tough decisions around how to organize care where they could eliminate every barrier that they could. But some of the barriers were embedded in our funding sources, the way we are funding healthcare, the way we have to get reimbursed for different types of kind of healthcare interventions, and had to look for alternative pathways to provide comprehensive human care that was needed. It was a true and continues to be kind of a sheer commitment on the part of kind of the institution and the leadership, but really hard because constantly also constrained by federal policy, by healthcare policy, by who we insure and who we do not. And so incredibly important that you can create something like the spot, but sustaining it in a policy environment that puts a lot of pressure on it not to exist or not to exist in the way it does, really, really complicated. And that's really what we're up against when we think about all of the types of either prevention programs, which we hardly fund, or intervention programs that are narrowed by what we consider appropriate or not for insurance funding. Really, there's a lot going on that all stacks up against, it stacks the getting the outcomes that we currently get.
Removal of the healthcare protections for the LGBTQ community is outrageous and terrible and bad, and we are morally, ethically, completely opposed to the federal government's policy on that. That said, folks are very vulnerable in this community. They often don't feel safe seeking healthcare. They worry about discrimination, and there's very clear data that many healthcare providers don't take appropriate histories and don't really understand how best to take care of patients. And so